At first, the left said that there were no surgeries being performed on children. Then the narrative evolved to it's only being performed on older teenagers. That's what we meant. It then evolved to, and we're only talking about top surgeries for teenage girls, which then slowly changed to, well, yes, they do sometimes. And then finally, we ended up with Texas Children's Hospital saying, okay, we'll stop. But did they? They did not. What ended up happening was leaked documents have come out showing that Texas Children's Hospital is still performing sex change surgeries and medical intervention on young children as young as 11. And what's the response from the left, who repeatedly said this didn't happen? The response was, how dare someone leak confidential medical information? To Chris Rufo, of all people. This is a massive scandal, ladies and gentlemen. Let me read for you the story from cityjournal.org. Sex change procedures at Texas Children's Hospital. Doctors said they would stop such medical interventions. Whistleblower documents prove that they haven't. Now, here's what's really fascinating. I think I have the tweets here. Let me see if I can pull them up from Chris Rufo. Not this Twitter thread. Perhaps it's this Twitter thread. In response to the leaking of this information, the doctors began purging information from the hospital website, as well as shutting down social media accounts. It's very strange. As brought up by Christopher Rufo and Colin Wright. Colin Wright says any other doctor performing any other procedure would simply defend it based on the evidence. A cancer ward would never scrub their website if you yelled that chemotherapy was poison. They'd simply explain how it helps cancer patients. Which brings us back to the big scandal here. It appears that these doctors know they are harming children, and they're trying to remove the evidence. City Journal, Christopher Rufo writes, last spring, executives at Texas Children's Hospital announced that they would cease performing transgender medical procedures on children, citing potential legal and criminal liability. The hospital's chief pediatrician, Catherine Gordon, an advocate for, quote, gender-affirming therapy, abruptly resigned. Rufo writes, I have obtained exclusive whistleblower documents showing that despite its public statements, the Houston-based Children's Hospital, the largest in the U.S., has secretly continued to perform trans medical interventions, including the use of implantable puberty blockers on minor children. As an institution, Texas Children's Hospital has openly promoted gender-affirming care to its physicians. In January of this year, TCH and Baylor College of Medicine, which works in partnership with the Children's Hospital, hosted a pediatric grand rounds titled Medical and Psychological Care of Gender Diverse Youth, describing the process of sex change interventions from puberty blockers to cross-sex hormones to genital surgeries. According to this presentation, TCH and Baylor College of Medicine encouraged doctors to begin treatment with puberty blockers and hormones during adolescence, and then consider surgeries, including breast removal and genital reconstruction in adulthood. Though the presenters explained that some surgical procedures would be appropriate for adolescents on a case-by-case basis. Now, the Twitter thread we have from Christopher Rufo in the article shows that they've actually continued to engage in these therapies. Now, I want to highlight this right here. Rufo states, another Texas children's doctor, Harvard-trained surgeon Christy Rialon, inserted and removed non-biodegradable drug delivery implants for gender dysphoria in pediatric patients on 11 to 15-year-olds. What was the response, of course, to this revelation? Leftism for you tweets. Nothing to see here. Just at Esquire, defending an 11-year-old getting a drug delivery implant to help with her transition to male and having an issue with real Chris Rufo exposing it. Chris Rufo says, according to medical records, Dr. Rialon surgically inserted a drug delivery implant on an 11-year-old female to male transgender person 3 days after the hospital had announced that it had stopped. Alejandra Caraballo says, who the hell is leaking confidential medical records of trans kids to Chris Rufo? This is a massive intrusion of privacy, and whoever did it violated HIPAA. Perhaps, but I do believe there are whistleblower protections, and it seems like this may actually be a criminal action or rogue. If the hospital says they're shutting down, they're not going to do this. Not shutting down entirely, but stopping child sex change treatments, and a doctor continues to do so. Is that not a rogue doctor? Unless, of course, the institution lied to the public and then began deleting the evidence. Now, why would they do that? Unless they knew what they were doing was wrong and they were hurting people and they're trying to cover it up. Richard Roberts, a University of Virginia trained endocrinologist and assistant professor at Baylor College of Medicine, who co-presented the grand rounds, is also listed in medical records as performing transgender medical procedures on minors at TCH. According to these records, Roberts has managed patients ranging in age from 12 to 17 years old for gender identity and dysphoria, with indications for medication, testosterone levels, medicine refill, and specialty services. Despite the hospital's statement that it had ceased these practices, Roberts has continued to manage a heavy caseload of gender-affirming care, including multiple patient visits in a single day last week for gender dysphoria and gender identity, and another for hormone replacement therapy. Another doctor at Texas Children's, a Harvard-trained surgeon, this is Christy Rialon, once again we mentioned her already, has also been involved in conducting trans surgical procedures on minors. They go on to mention the 11-year-old who received a drug implant device. The patients getting implants from Rialon were 11, 12, 13, 14, and 15. It says implants or removals. 11, 12, 13, 14, and 15. Other medical records confirm that Rialon has administered the drug Supralin LA. Supralin LA, an implantable gonadotropin releasing hormone medication that is one of the most commonly used drugs for blocking puberty in trans-identified children. The executives at Texas Children's appeared to be playing a duplicitous game. They announced the hospital had stopped performing transgender medical interventions on minors. But this is simply untrue. TCH doctors administered such procedures days after the announcement, and they have continued to perform them throughout 2022 and 2023. If gender-affirming care is truly the gold standard in medicine, TCH should defend it openly, not perform it in secret. State legislatures currently considering a bill to ban such procedures should launch an investigation into the hospital and require those involved to account for their practices or face severe consequences. Interestingly, Chris Rufo tweets, Texas Children's Hospital has quickly wiped Dr. Christy Rialon's bio from its website after I exposed the Harvard-trained surgeon for performing sex change procedures on children as young as 11 years old. As I write my report, if gender-affirming care is truly the gold standard, they should be defending it. Colin Wright says any other doctor performing any other procedure would simply defend it. Now, I read that one, but let's elaborate there. Cancer. We give people chemotherapy. We know that chemo causes people to undergo serious side effects, but we accept it. Some people don't. Some people say there's got to be other methods and chemo is very, very bad for you and has a low success rate. Fine. But most people understand the general idea around chemotherapy. When people criticize hospitals, and they do a lot, there's many people, Google search this, who say that chemo killed their loved one. It wasn't the cancer. Nobody at these hospitals is deleting their oncology department bios, their oncologist doctors. No one's removing any of the information. They're simply saying it's the best we've got. What more can be done? So why erase information on the child sex change surgeries being performed at this hospital unless they know what they're doing is wrong? I have to wonder how it is there are so many people who are engaging in these practices. In this image, Rufo says, according to internal records, Dr. Richard Ogden Roberts, has managed patients ranging from the ages of 12 to 17-year-olds for gender identity and gender dysphoria, with indications for medication, testosterone levels, medicine refill, etc. Why are they hiding this? And what is their true intention? I suppose the left will make the argument that they fear it will be made illegal, so they're trying to hide it. But that's not how you win civil rights. We didn't have, those who oppose segregation secretly trying to break segregation. They did it openly to make sure everyone knew. Marijuana is becoming illegal across this country, not because people were hiding and doing it. It's because they publicly did it. Dave Chappelle made a movie called Half Baked. Think about how funny that is. A movie, extremely popular cult classic with the famous comedian in the world. It's an older movie. It's from, 2000s? About smoking pot. A drug that is still illegal at the highest levels federally in this country. Yet people were so open about their doing of it. It was so culturally acceptable, the law changed. So why cover it up? My view on this is that these doctors know what they're doing is evil. They know what they're doing is wrong. And they know this is not something that will be accepted. They're causing serious harm to children, probably for experimental reasons or maybe ideological reasons. And it's horrifying. But I'll stress this point. When progress comes about in this country, it's through public acceptance and loud voices, marching across a bridge, refusing to adhere to segregation rules. It came with people demanding it and filing lawsuits about it. Interracial marriage, a lawsuit, not deleting and hiding it. It came to the end of civil slavery came with a civil war of people screaming to the high heavens, it must be done. Slavery must be over. Not hiding their beliefs. So I have to wonder. Good job to Chris Rufo. I'll leave it there. Next segment's coming up at 6 p.m. on this channel. Thanks for hanging out, and I'll see you all then.